Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. I'd like to discuss some ongoing symptoms.
Of course, tell me what's been going on.
For the past 6 months, I've been experiencing severe joint pain and stiffness, especially in the morning. It's getting harder to even do basic tasks.
I'm sorry to hear that. How old are you currently?
I'm 52 years old.
Have you noticed any other symptoms? Swelling, redness, or warmth in the joints?
Yes, my fingers and wrists are often swollen when I wake up, and they sometimes look reddish.
Are there any other medical issues or surgeries you've had recently?
I had a knee arthroscopy about 2 years ago due to a torn meniscus. But other than that, no recent medical concerns.
Are you on any medication currently?
Just over-the-counter ibuprofen for the pain and a multivitamin.
I see. Given your age, symptoms, and the duration, it sounds like you might have rheumatoid arthritis. We'd need to do some tests to be sure, including blood tests and perhaps some imaging studies.
I've read about that. It's an autoimmune disorder, right?
Yes, that's right. The body's immune system mistakenly attacks the joints, causing inflammation and pain. If left untreated, it can lead to joint damage and deformities.
Is it treatable?
Yes, while there's no cure, there are medications and therapies that can help manage symptoms and reduce joint damage. Early diagnosis and intervention are crucial. We'll start with some tests and go from there.
Thank you, doctor. I just want to get some relief and understand what's going on.
I understand. We'll work on this together.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor. Good afternoon. Please have a seat. How can I assist you today?
For the past 6 months, I've been experiencing severe bouts of breathlessness, especially when I climb stairs or walk a little fast. Recently, I've also noticed swelling in my ankles and feel fatigued all the time.
Your age?
38 years old, doctor.
Do you have any chest pain or palpitations?
Occasionally, I feel a slight discomfort in my chest, but it's not very painful.
Do you have a history of high blood pressure or diabetes?
Yes, I've been diagnosed with high blood pressure a year ago, but I've been irregular with my medication.
Any history of asthma or allergies?
No, doctor.
Do you smoke or drink?
I quit smoking 3 years ago, but I drink socially.
Is there any family history of heart diseases or other illnesses?
My grandfather had heart disease, and he underwent bypass surgery in his 60s.
Based on your physical examination, your BP is 140/90, and there are signs of fluid retention in your legs. Your ECG also shows some irregularities. The symptoms you've mentioned could be indicative of a heart condition, possibly heart failure, or some other cardiac issue.
Is it very serious, doctor?
It's crucial that we address this promptly. We need to get a detailed cardiac evaluation, including an echocardiogram and possibly a cardiac stress test. Based on those results, we can determine the best treatment approach.
I understand, doctor. I should have paid more attention to my symptoms earlier.
It's never too late to take action. We'll get you the necessary tests and determine the best course of action. It's essential to be consistent with your medications and make some lifestyle changes.
Thank you, doctor. I'll follow your advice.